If you were given the choice of having to suffer a year of major depression or dying a year earlier than you otherwise would at the end of your life, which would you choose? We've done the stay-at-home orders, the lockdowns, the reduction, the closing of the restaurants and the bars and the churches and the health clubs. The Wellbeing Trust estimated going to be 68,000 excess deaths of despair caused by COVID. We are throwing 275 people into major depression for each one person whose life we are saving by our COVID policies, our COVID restrictions. My name is Hugh McTavish. I have a PhD in biochemistry from the University of Minnesota. I also have a law degree. I've worked as a scientist really most of my career, also as a patent attorney, I guess, lately. But I've got a number of scientific articles, over 10 journal articles, peer-reviewed journal articles that I've authored, and about 15 patents that I'm the inventor on. But we knew our response would throw people out of work. We knew it would increase loneliness, social isolation, and depression, and we knew that would lead to suicides and deaths of despair. And we certainly knew that we were impairing our kids' education, and we certainly knew that everybody would be lonelier and less happy when we isolated people from each other and threw them out of work. We chose to do that anyway. You divide 690,000 person years of life into 328 million people, and you get a figure of 0.0021 years per person, which works out to 0.7 days of life extension per person. Even giving a generous estimate of how many lives we've saved, it works out to a life extension of less than a day per person in the United States. So I ask you, has it been worth it to you to live the way we've lived for the past 9 months to extend your life by 1 day?